Hey everyone, and welcome. If you're studying for the NCLEX or you just really need to nail down the essentials on Methergine, you've come to the right place. We are going to cut right through all the fluff and focus on exactly what you need to know to be a safe, confident nurse. So let's just jump right in. So here's our game plan for today. We're going to start with the basics, the what. Then we'll cover why we use it. After that, we'll get into the really practical stuff, like how to give it safely. We'll cover what to watch out for, and then wrap it all up with the absolute must-knows for your exams. Sound good? Let's do it. All right, section 1, the basics. First things first, we've got to build that foundation. What exactly is Methergine, and what's its main job? Okay, so Methergine, also known as methylergonovine, is what we call an ergot alkaloid. And yeah, it's actually derived from a fungus. But what you really need to remember is that these things are super powerful at constricting smooth muscle and blood vessels. So for your exam, and more importantly for your actual practice, when you hear Methergine, your brain should immediately scream postpartum hemorrhage. Its entire purpose is to prevent that uterus from getting boggy and to stop a potentially life-threatening bleed after delivery. It's a real lifesaver. So that's what it's for. But how does it actually work? I mean, how does it pull off such a powerful effect? Understanding this is the key to, well, everything else about this drug. The cool thing about Methergine is that it does not mess around. It goes straight for the source, the smooth muscle of the uterus. And it just cranks everything up, the tone, the rate, the power of those contractions. It creates this intense, sustained contraction called a tetanic effect. The best way to picture it is like the drug is literally clamping down on the uterus. And when it does that, it squeezes those bleeding blood vessels shut. That's why it's so incredibly effective. All right, let's shift gears and talk about the practical side of things. How do we actually give this drug safely? Because this right here is where you, the nurse, become absolutely critical to patient safety. So you've got 3 main routes: by mouth, into the muscle, or into the vein. Now pay close attention to the onset times here. PO takes about 5 to 10 minutes to get going. IM is faster, kicking in within 2 to 5 minutes, which is why it's often preferred. But IV, it's immediate. And that incredible speed comes with some pretty serious risks, which brings us to our next point. And here it is. This is a massive warning you have to take seriously. IV Methergine is for life-threatening emergencies only. Why? Because that immediate, powerful vasoconstriction can make the patient's blood pressure just skyrocket, which could, and I'm not being dramatic here, lead to a stroke. So think of IV Methergine as a high-alert, last-resort, life-saving measure. Okay, this slide right here is basically your nursing checklist. It's non-negotiable. Before you even think about reaching for this drug, you must check that blood pressure. And if you're in that emergency situation giving it IV, you push it slowly. We're talking over at least a full 60 seconds, all while keeping a close eye on that BP. Oh, and notice this is considered a hazardous drug, so you need to be using proper PPE. These steps are what keep your patient safe. Of course, with any drug this powerful, there's always a flip side. There are risks. So let's break down the adverse reactions you have to be watching out for, and more importantly, what you're going to do about them. Well, would you look at that? It all comes back to blood pressure, doesn't it? The single most common side effect you're going to see is hypertension. It makes perfect sense, right? The drug constricts blood vessels, so the pressure goes up. The second most common is headache, which, you guessed it, is often tied to that spike in blood pressure. This is exactly why that BP check before you give the med is your absolute #1 priority. This chart lays out your plan perfectly. It's a simple if this, then that. If you see high blood pressure, you monitor it and you hold the next dose. If, in a very rare case, something severe like a seizure happens, you're putting precautions in place. Patient feels nauseous, you're ready with the antiemetics. This is nursing in action, using your assessment skills to keep your patient safe from harm. Okay, now for the big red stop signs. These are the situations where giving Methergine is not just a bad idea. It could be incredibly harmful or even fatal. Listen up, because if you memorize only one drug interaction for Methergine, this is it. It is an absolute contraindication to give this drug with what are called potent CYP3A4 inhibitors. You'll see these everywhere. We're talking grapefruit juice, some antifungals, certain antibiotics like erythromycin. Let me show you exactly why this combination is so dangerous. So, when you block that CYP3A4 enzyme with one of those other drugs, the Methergine levels in the body can't be broken down. They just skyrocket. This leads to a condition called ergot toxicity. It's basically a massive overdose of that vasoconstriction effect we talked about. The blood vessels clamp down so hard that blood can't get to the arms and legs. This can cause severe pain, numbness, and in the absolute worst case scenario, gangrene and stroke. This interaction is deadly. You have to know it. Here's another huge safety point, and this one is all about patient teaching. The rule is crystal clear. Your patient has to avoid breastfeeding while they are taking Methergine and for at least 12 hours after their very last dose. The drug can get into the breast milk, and we don't want it affecting the baby. So that means any milk they produce during that time, it needs to be pumped and dumped.
Whew, we have covered a ton of ground. So let's boil it all down to the absolute essentials. Think of this as your high-yield final exam cheat sheet. This is the stuff you gotta know.
Okay, let's do a rapid-fire review. Methergine, postpartum hemorrhage. How does it work? Powerful uterine contractions. Top side effects, hypertension and headache. Your #1 assessment, always check that BP first. The IV route, emergency only, push it slow, and watch for stroke. The deadliest interaction, those CYP3A4 inhibitors. And finally, what do you tell your patient about breastfeeding? Stop for at least 12 hours after the last dose. You know these points, you are golden. So I'll leave you with this. Picture it. You're on the floor, you have a postpartum patient, and there's a standing order for Methergine. You go in, you take her vitals, and her blood pressure is 160/100. Based on everything we just talked about, what do you do? What's your call? Think about it. Thanks so much for joining me, and good luck with your studies.